afternoon, everyone. My name is Silke. I'm a German neurologist, and it is my greatest pleasure to be here today with my co-moderator, Sarah Gorey from Dublin University, with Professor Zhao Jing from Fudan University. She's a lead investigator of the 120 Stroke Awareness Program in China. That's an important and huge program. And we will hear a little more about this program in some minutes. And with Professor Melinda Roaldsen, she is from the Arctic University in Norway, and she's the SAPI, the Stroke Action Plan Europe Chief Operation Officer. And Melinda has a lot of experience in stroke awareness and how we can manage to have our patients arriving at hospital much earlier than at the moment. And we are straight away in the center of our today's topic, which is pre-hospital delay.
Yes,
Sarah.
So pre-hospital delay is any delay that causes the patient to be delayed coming to hospital. And there's so many factors that can contribute to this. And about 50% of our patients don't arrive in time. I know that in Ireland, only 10% of patients get thrombolysis, and a big driver of that is pre-hospital delay. But I'd be really interested to hear, Professor Zhao, about the experience you have in China of educating the emergency services to try and improve pre-hospital delay, and what your experience has been like in China.
Yeah, we have worked a lot of years to promote the emergency staff and community doctor education, because you know, the stroke center have progressed in China for many years, and then the thrombolysis was used in every county level hospital. But the thrombolysis rate is so low in China, about only 5%. Yeah. And the main reason is the severe pre-hospital.
I think education of emergency staff, as you said, is really, really important. Paramedic education, emergency doctor education.
Yeah.
How did you approach that? What educational program did you start?
Yeah, because about 10 years ago, the emergency staff didn't know the thrombolysis method and the thrombolysis window time. So when they received a stroke, they didn't know it is as fast as go to the hospital. So we began to educate the emergency staff and the community doctor. And first, we always think they are the important people to be educated. And first, then they will promote the education to the public. So we made many lectures to them, and it made a great progress and the education program.
I mean, this is certainly very clever. You have to start at some point, and of course you're right, if those who deliver the care, if they don't know what therapeutic options there are, we wouldn't reach any aim. And I think we have developed stroke medicine quite a bit in the last decade, but now it's really about how to get the patients to hospital very fast.
Exactly. If the patient doesn't arrive at the hospital for us to give the acute treatments, it's a big problem.
Yeah.
What kind of improvements did you see after you started engaging with the emergency services to better educate them about stroke awareness?
Emergency staff and the community doctors are very huge in China, and we have the organization by our government. So we often built a team to educate them, and after the education, their stroke awareness enhanced remarkably, and through our Stroke 120 program, our emergency number, call emergency number rate from about 5% to 33%.
Wow, so an improvement from 5% to 33% after bringing in the Stroke 120 program.
Yeah.
Fantastic.
That's fantastic news.
Yeah. And the pre-hospital delay from 15 hours reduced to 6 hours.
Brilliant.
Okay.
So before this program, it took on average 15 hours for someone to reach the hospital, but after the education, it was down to 6 hours, which is really good news.
Yeah.
Fantastic. And
for the point is time is brain, as we all
Correct.
know,
Yeah.
and every 1 hour delay is results in 11 months of healthy life lost. Actually, even 15 minutes delay worsen outcomes. So this is very important, the work you have done.
And especially, I mean, 15 minutes in the pre-hospital setting is literally nothing.
Yes.
This is just, time runs so fast, and you lose 15 minutes. This feels like a second, and that is certainly a big challenge. I mean, having all the EMS teams, paramedics educated is a very crucial point, and I think we have to work on that much more, because, I mean, medicine has developed a lot, stroke medicine has developed a lot, and of course not everyone. They are generalists, usually paramedics and emergency doctors. So we need to tell them, listen, now we can really treat these patients, but we need your help, kind of.
Stroke care has actually revolutionized
Correct, exactly,
the
it's a
last
revolution.
30 decades, and it is the most cost-effective
Yeah,
treatment.
that's an important point. That's an important.
We must work on multiple levels, not only to the general public, to the paramedics and the GPs, the family doctors, the ones that are closest to the patients out in the community. And this is so important.
Yeah, it's quite a complex pre-hospital cascade, and it also, of course, involves the dispatch center. So usually what we know is that if people call the ambulance service, they arrive at hospital much faster, they get a faster in-hospital treatment, that is quite clear. But unluckily, we face the problem that dispatch accuracy is not ideal. So it ranges between 30 to 50%, which is definitely clearly not enough. So we do miss stroke patients, they get dispatched as non-stroke patients, and if we're unlucky, they don't get identified at the emergency site. But also, stroke patients or patients get dispatched as suspected strokes who aren't strokes at the end, and they then, we all know these systems are stretched, and they then add a little more to this already quite overcrowded and difficult to manage system. So, does any one of you have any experience with dispatch accuracy or any? What are you've analyzed that in your program, dispatch accuracy, and you've worked on that, Professor Zhao? Do you want to share with us some of your experience?
So I think the public stroke awareness should be promote covered all ages, for elders, for adults, or even the students. So when we promote Stroke 120 in China in 2016, and why we promote this project, because fast doesn't work well in China. And most of Chinese don't know English, and they didn't know the meaning of the fast. And even though when fast was translated into Chinese, it loses its meaning, the speed. So the people don't understand it. So we link stroke to 120. 120 is the unique emergency number in China, and almost everyone know it. So we transfer the 3 number into 3 identified steps. 1, look for uneven face, and 2, to examine the weak arm, and 0 to listen to the slurred speech, and we link stroke to emergency number, so people recognize the symptoms and evoke them to take action immediately. So
yes,
it is easy to.
It's very important.
Yeah.
Drive in meaningful campaigns that provide a context to the nationalities, and this translational work. It's so important.
And we hope the experience of stroke 120, stroke plus emergency number, will be benefit for the non-English speaking country.
And that's quite a very important point you raise. What we have to keep in mind, systems are so different, and there are different characters, luckily, because otherwise the world would be really boring. But we have to keep in mind that all these pathways we develop need to be adjusted to the local setting.
Yes.
Because there are so many different regions, there are so many different countries, and it must fit to the local situation, otherwise we will not succeed.
And I think our challenge for the future with stroke will be delivering care in lower and middle income countries. So this
Good
type
point.
of work that can translate the fast score, the fast sign, cannot work in every context. So
and link that to immediate action. And in an expert opinion summary statement from 2024, led by the World Organization Task Force for Prehospital Care, recommended that changing stroke awareness to stroke action awareness is so important for it.
That's right.
Yeah.
That's right.
the action word is
Exactly.
important, that
The action,
you recognize
clearly.
it and then you act, that it's not enough to just recognize.
And I mean, patients do know that for a heart attack, but it's so painful, they would always call.
Yeah.
And for stroke, we really have to transfer the information that symptoms means action now and not later.
So we promote from stroke awareness to stroke action awareness. If you recognize the symptom, but you don't take action, and the pre-hospital is also delayed.
Correct. That's very correct. And we have that challenge that it's very different in every region, and you're completely right, Sarah. Low and low middle income countries, they've got a completely different system. But not only that, we also have higher income countries that have rural and remoter areas, and it's very difficult to look after these patients because the next healthcare facility might be quite far away. And I think, Melinda, you've got some experience coming from the Arctic University.
Yes,
you have some experience.
That is true, and it is quite a lot of innovation that comes from Norway regarding this, and there is e-stroke app, for example, that the Paramount that Alice Schönlett Sunset that, and even our local university has an innovative project regarding pre-hospital care using an innovative kind of telemedicine solution, and it has gained quite traction. There were visitors from Mayo Clinic in December visiting
the area. The
Yeah.
area to see how it goes. And I mean, we must be very innovative and we must be creative, otherwise we will not find any solution. How do you do that in rural Chinese areas? It's difficult.
Yeah, how to improve Chinese public awareness.
And in rural areas where there are not many hospitals, how do you get these patients?
How to is so I just said all ages of people should be educated, because the stroke may occur at any place, or at home, or in the public, or in any other area. So we produced a series of material and aims to different ages, for elders, for adults, for students. And for elders, we first educate community doctor and emergency staff, and they began to promote the stroke 120 in the community. And so they are the main force to go deep into the community. And
kind of a domino effect.
Yeah. And second, aim to adapt, because all of us go out to work. So we use the platform, the social media, the online. So we produce the video, especially short video. Short video very popular in China. So we shoot 1 minute stroke 120 video, and to play online all of the China, and many our colleagues translated our video into 50 dialect.
All right.
50 dialect, and so many people like their dialect. So the online spread is very large.
It's so important to reach as many people as possible, and these resources sound very useful to do that.
Yeah.
So how do we reach people? How do we make sure that if a person is experiencing a stroke, or their loved one at home experiences a stroke, that they know that they need to act, and that they, that they don't delay calling for help? How can we work on that?
We must work with multiple campaigns in multiple levels, in multiple planes, relentlessly. And
that's a crucial point. If I may just, for the audience, add that we know that public awareness campaigns, they do help, but we also know that all these campaigns, after a period of roughly 6 months, the awareness goes down again. And this is quite a relentless job to do and to constantly work on.
Yeah.
And you've got a lot of experience.
Yes. Coming straight from Geneva, actually, to Helsinki, and the first in-person event of the Global Stroke Action Coalition. And it is first ever global advocacy movement to reduce the burden of stroke for everyone, everywhere. And it is crucial for someone every 2 seconds is having a stroke.
Yeah, that's an important information. It happens all the time.
Yeah.
And you are right. It needs joint efforts and joint forces to tackle that problem. That patients, if we manage everything perfectly in hospital and also in the EMS, the emergency medical system, we still have to tackle that problem that patients don't call early enough. Yeah. And you've done a great job there.
Yeah. And I think it is so important. This Global Stroke Action Coalition was launched in April, and it is driving momentum and change up until the UN high-level meeting on NCDs in September this year. So look out for various activities regarding that. And it is of course ISO endorsed, and it is multiple stakeholders all over the world, and it is driven by the World Stroke Organization.
And it is aimed at raising awareness in the public, just to emphasize that again.
Yes.
So what we can all do is probably share that information that there is a stroke coalition, so that everyone in every corner of all countries knows about that at the end, hopefully, of that year.
Yeah.
Similar to what you've done with your 120 project, or what you are still doing.
Yeah.
I guess you are still going on educating the public.
Yeah.
It's relentless, isn't it?
Yeah, yeah. And we produced a lot of many kinds of material, like the video, like the book, like the comic, and the game for students, and the minor film. And I introduced one of our minor film, the Wake Up, Stroke 120, Wake Up. The Wake Up won the International Minor Film Award in New York, and then the president of this minor film, president of the game.
Society.
The robot, Mr. Robot, was deeped by this movie.
Yeah, that's quite a great idea to translate it into modern.
Artist method, because his brother died from stroke.
Right. Yeah, that's it. Personal motivation.
And the dramatic is a year later, he occurred.
Oh dear.
Stroke, and he reminded the stroke 120 in our film. So he called 911 immediately and go to the hospital, ask for the help, and get thrombolysis and recovered immediately, and come back to his work. And also later we make another microfilm about his experience. The name is "This Movement Saved My Life."
That's fantastic work. That's really fantastic.
So important to incorporate lived experience, and that is a crucial point. And I think we have to have a lot more of that.
What would be your most important message you want to share with all, coming just from the coalition meeting in Geneva?
Yeah, I believe we have to join forces. We have to work together to put stroke in the forefront of all entities. As I said earlier, it is the most cost-effective treatment, and it is quite mind-boggling that it has not been
that has been
celebrated.
Earlier. I think we have a big job to do, and we have to join forces, not only academia, but clinicians, the lived experience community, the stroke support organization, the carers, and the general public must know. And most importantly, we must involve the policymakers. They are the ones that can drive change.
The word must spread.
Yes.
And I think you brought a little video for us,
Yes.
which we would like to share with the audience today. And otherwise we would actually say thank you for listening to this ESO TV session.
And thank you to our guests, who are two real leaders in improving pre-hospital delay worldwide. So thank you for joining us and sharing your experiences.
Thank you.
Thank
bye-bye.
you.
Stroke is preventable, treatable, and recoverable.
Recent breakthroughs have revolutionized the prevention and treatment and bring the potential to cut the burden of stroke in half.
Effective stroke treatment and rehabilitation improves patient outcomes and reduces disability and dependency.
Alleviating the burden on families, caregivers, and communities.
Every minute a stroke is untreated,
1.9 million brain cells die.
every minute counts.
We need
Stroke action
Now.